Right, okay, so let's have a discussion about what the correct answer might be. So we decided we're going to start with systole or systole, depending how you pronounce it. So that we agreed that when ventricles are contracting, right? So what do we want AV valves to be doing at this point? Do we want them closed or do we want them open? What are your thoughts? Closed, okay. What about SL valves? Open. Terry, can you kind of talk me through it? So why do we need this is correct answer, by the way, so well worked out. So why how did you arrive to that answer?
So for an example, with the aorta,
Yep.
so blood will come in by the pulmonary veins into the atria. Then obviously it goes through the valves, which would be open, into the ventricle. Then the valves need to close, maybe due to allow that pressure.
Right.
So then blood can go through the atria. So the valves of the semilunar valves in the opening of the atria.
No, the aorta. Yeah. Okay.
Would need to be open to allow blood to go
To
through.
leave, right. So if we think about it, right, so when I'm contracting ventricle, and Terry had an example of the left side, so if you just think about left side, what's happening there. When I'm contracting that ventricle, what I'm really trying to do is send that blood towards your body. So I need as much of a push as I can possibly create to send as much blood as I can into aorta. And because I'm trying to get that blood into aorta, I've got to have semilunar valve open, right? Because otherwise, well, it's going to be just a door blocking aorta, and that's not what I want to do. But at the same time, I want AV valve to be closed because I don't want that blood coming back towards atrium, right, left atrium. And the same picture is going to be on the right side, obviously, but in that case, it's going to be to do with pulmonary, trunk pulmonary arteries. Okay, good, well worked out. Right, Laurie, did you have an answer for diastole?
Just the other way around.
Right, exactly. So you need AV valves at that point to be open and then SL valves to be closed. Can you try to justify it? Talk me through your line of thinking. It is correct.
So you want it to travel, but you don't want it to come back, so one needs to be open and then the SL valve needs to be closed to stop the backflow.
Right, exactly. So here I'm wanting that blood to get into ventricles from atria, so I want ventricles to start filling up. So I want that doorway to be open, but then I don't want the blood which I just sent into aorta to come back flooding into ventricle. I want it to stay in the aorta, so I want that doorway now closed. Okay? If you are struggling to visualize it, there is a link to a really good video, which is cardiac, to do with, I think it's called circulatory system, but I'm going to put link to it on VLA. Just have a look at animation of those gates opening and closing, or valves opening and closing, and hopefully this will help you to put it in as a kind of visual, create visual picture. Okay, but everybody well worked out. Karen, did you have the same
Yes,
answer?
I have the same.
Yeah, brilliant. Okay, good. Some people really struggle with it because you do need to be able to visualize things in your mind's eye. And some people are really good at it.
I've seen
and
a
some
video
people aren't
before.
really not very good, and that's not your fault. It's just the way your brain works. So if you didn't quite arrive to this answer, don't feel disheartened. Just have a look at the animation of this process, and hopefully it'll click. All right. So another question to do with contraction or relaxation of ventricles, obviously. Does anybody know, that sound of the heartbeat, right? Which, particularly if you're already in healthcare, you probably have experience of listening to somebody's heartbeat. Has anybody had that experience, right? So, do we know what creates that sound? Very few people sort of think about it because we take it for granted, don't we? And we never really consider, well, what is it that is making that sound of a heartbeat? Does anybody have any suggestions about that? And the same to people on the video. So if you have an idea of what that is,
Is it the
pause it and give your sort of answer before you move on.
Is it the blood that you can
is the blood rushing through the heart, you're thinking. Okay, any other suggestions?
Is it valves?
Is
like
it valves?
closing?
Okay, closing. Some people think that it's the sound of heart kind of bouncing against your ribs almost, you know, against the other organs around us, so lungs and ribs and etc. And you know, some people think it's the muscle contracting, relaxing, which is creating the sound. But the actual answer, and Terry is absolutely right, it's the sound of valves closing and opening. That's what creates that heartbeat. And if you think really carefully about how your heart sounds, so just remember yourself maybe when you're stressed a little bit or you're running and you can kind of hear the sound of your heartbeat in your ears, right? Or maybe when you're listening to somebody else's heartbeat, if you really sort of concentrate on that heartbeat, you will notice that it's got two-tone sound, right? So you get t, 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 t. Okay. Do you know what I'm talking about, right? So this kind of slightly louder sound and then more muted sound is the second tone. Why do you think you have two-tone sound?
For the different valves.
Exactly. So different valves, that's all it is. So your louder sound, that first t, that's your AV valves closing. And this more muted sound, the second is t, that's your SL valves closing. Okay? And there is a technical term, I do not know if anybody ever heard this before. It's known as lub-dub. Anybody heard that term before? Lub-dub, okay. So lub. Sounds a bit funny, but it's just literally like a mimicking the sounds of the heartbeat. So lub is this louder sound. So this is sound of heartbeat. And this is not my invention, this is literally technical terms which are sometimes used. Okay? So louder sound, this is to do with AV valves. And then this more muted sound, quieter sound, the second tone is the SL valves. Okay, so softer sound.